throughout the pandemic, we've seen a lot of disparities, including and particularly amongst the African American communities, both in terms of who is dying first of all, and who is being hospitalized. But then we began to address some of the root causes, which were related to access to testing, and related to probably a lot of structural racism that was highlighted in terms of underlying issues in many vulnerable communities. I think it was interesting that and of course politics played a role, but even after the new administration, those disparities still persisted. I think one silver lining was that vaccinations increased uptake in all communities, probably given the advocacy of a lot of grassroots organizations and community-based organizations. So where does that leave us now? I think there's been probably less attention paid to how COVID is affecting different communities, but I do worry particularly that testing is linked to access to early therapy. And because testing has a premium and price associated, that will leave a lot of people behind, because who's going to go and pay $25 for a test in Walgreens if you have some sniffles and it might be allergies, and then it might be too late